Hi, I'm Dr. Roger Fonts, orthopedic surgeon in Nevada, and we're going to be talking in this video about location and types of hip pain. As a pretty busy hip surgeon, we see a lot of hip pain in my clinic, and I thought it might be helpful to break down the locations of pain and what types of problems cause pain in each of the locations so we can think about that in a more anatomic way. So in the diagram, and the gentleman who's facing us, we can indicate the area we call anterior or front pain. This area typically extends from just below the belt down across the groin and then into the thigh area. This is the area where hip arthritis classically causes pain. Over 90% of hip arthritis patients will have pain in this area. Other things that can cause pain in this area would be a labral tear, which is a cartilage tear in the hip, as well as flexor tendonitis of the psoas tendon. Other non-orthopedic sources of pain in this area could include an inguinal hernia or a femoral hernia as well. Since my majority of my practice is based on treating types of anterior hip pain, hip arthritis, labral tears, etc., I think I'm going to make a separate video on that in an effort to keep this video somewhat shorter. So let's move on to lateral pain. So you see on the side view, we've indicated pain at the lateral aspect of the upper thigh. And in this area, typically the source of pain is classically thought of as bursitis and more recently tendonitis or tendinosis. Our understanding of this location of pain has changed a bit now that we have higher quality MRIs. So with MRI, we're now seeing that most patients that were classically diagnosed with bursitis of the hip don't in fact have bursitis at all. What they have is inflammation of the gluteus tendons, which are the side tendons that attach onto the top of your femur. So tendonitis is inflammation of these tendons, and tendinosis is age-related degeneration and micro-tearing of the tendons. In general, the treatment for tendonitis of the hip is a combination of rest, ice, and elevation, physical therapy, stretching, and cortisone injections. We do get most patients over these problems with that treatment, but occasionally it's quite stubborn. I have used platelet-rich plasma injections occasionally, and there are surgeons in town that will do arthroscopic debridement of this if everything else has failed. It's more common as people get older, and unfortunately it's more common in women than men. Okay, so let's move on to posterior pain. This is the final picture. We see the gentleman has pain in the upper buttock region. This area is where pain from the lumbar spine classically refers. When someone has posterior pain in this area, it's generally degenerative arthritis or disc herniations in the lower lumbar segments, usually L2 through S1. You can also get pain in this area if you have inflammation in your sacroiliac joint. And in deeper tissues, you can get pain from tendonitis of the external rotators, such as the piriformis tendon or obturator tendon. I think these are actually overrated sources of pain in this area. It's most typically back pain. This confuses people. They would think that back pain would cause midline pain a little higher up in the back. But our brain generally processes pain arising from the lower lumbar spine as into the buttock area and sometimes down into the lateral thigh. If you have sciatica, which is compression of your sciatic nerve as it exits the nerve roots out of the spine, you'll then get pain radiating completely down your leg. If we diagnose you with low back pain or sciatica, I'll generally recommend that you see one of my spine colleagues and or our pain treatment physicians to initiate treatment. So we've talked a lot about location of pain and different etiologies of pain in these areas. No matter what it is, we should be able to identify the source of pain, and we almost always can apply treatments that will get you feeling good. I hope you've enjoyed this video, and if you have, please subscribe to my YouTube channel. And as always, remember, the best patient is an informed patient. Thank you very much.